Picture this. A colonoscopy is a painful procedure that leaves you in discomfort for days. Sounds familiar? Well, it's time to debunk this myth. Often, when we talk about colonoscopies, a pervasive image of pain and discomfort floods our minds. This image, however, is rooted more in fiction than fact. With the advancements in modern medicine and technology, the reality of a colonoscopy is far from the horror stories we've been led to believe. Let's start with the basics. A colonoscopy is a medical procedure that allows doctors to examine the inner lining of your large intestine. It's a crucial tool in diagnosing a variety of diseases, including colon cancer, which is the third leading cause of cancer-related deaths worldwide. But here's the catch. It's not the ordeal it's often made out to be. The procedure itself is typically performed under sedation, which means you're unlikely to feel anything during the exam. The sedatives used are designed to keep you relaxed and comfortable, and most people don't even remember the procedure afterwards. So, the fear of unbearable pain? It's mostly unwarranted. Now, I won't sugarcoat it. There can be some discomfort afterwards, but it's usually mild and short-lived. You might feel bloated or pass gas because of the air introduced into your colon during the procedure. But intense pain? That's a rarity, not the norm. So where does this myth come from? Well, a lot of it stems from the fear of the unknown. The mere thought of a medical procedure can be unnerving, and our minds have a knack for amplifying these fears, especially when it comes to our health. But it's important to separate fact from fiction. And the fact is, a colonoscopy is a routine, safe, and crucial procedure that can save lives by detecting diseases early. It's not an ordeal to be feared, it's a tool to be appreciated. So the next time you hear someone say a colonoscopy is painful, you can confidently say, that's a myth. Now that we've busted a common myth, it's time to address some of the common questions and concerns about colonoscopy. So what exactly is a colonoscopy? Well, it's a medical procedure that allows your doctor to examine the inner lining of your large intestine, that is, your colon and rectum. It's performed using a thin, flexible tube called a colonoscope, which has a small camera attached to its end. But why is it necessary? Colonoscopy is a crucial tool in detecting abnormalities and changes in the colon and rectum, including polyps, which can sometimes turn into cancer. It's also used to screen for colorectal cancer, which is the third most common cancer in both men and women. By catching these issues early, treatment can be more effective, improving your chances of a healthy outcome. At what age should one start getting a colonoscopy? Generally, it's recommended that individuals with an average risk of colorectal cancer start getting screened at age 45. However, if you have a family history of colorectal cancer or other risk factors, your doctor may suggest starting earlier. Now let's address some concerns about the procedure. How long does it take? A colonoscopy typically takes about 30 minutes to an hour. But don't worry, you'll be sedated for the procedure, so it will feel like it's over before it even started. Speaking of sedation, yes, anesthesia is used during a colonoscopy. It's typically a mild sedative that helps you relax and feel comfortable during the procedure. You'll be awake, but you probably won't remember much about it. And what about the recovery period? After the procedure, you'll need a few hours to start feeling normal again as the sedative wears off. You might experience some gas or bloating, but these effects are usually temporary. It's essential to arrange for someone to drive you home after the procedure, as the sedative can make you drowsy. Remember, no question is too small when it comes to your health, so never hesitate to ask. Now that we've addressed some common questions and concerns, let's delve into the crucial step of preparation for a colonoscopy. Preparation is not simply a prelude to the main event, it's an essential component of the colonoscopy process. Why, you ask? Well, the answer lies in the need for a clear bowel. Imagine trying to navigate through a forest with dense undergrowth. It's challenging, isn't it? Now consider your bowel as that forest, and the food residues as the undergrowth. The clearer the pathway, the easier it is for your doctor to explore and identify any abnormalities. The preparation process typically begins a few days before the procedure. You might need to adjust your diet to include low-fiber foods that are easier to digest, thus leaving less residue in your bowel. This might involve bidding a temporary farewell to your favorite fruits, vegetables, and whole grains. But don't worry, it's not a long goodbye. The day before your colonoscopy, you'll switch to a clear liquid diet. This might sound tough, but remember, it's a small sacrifice for a comprehensive examination. You can still enjoy clear broths, tea, and even certain flavors of jelly. It's also crucial to stay well hydrated during this time, so don't forget to drink plenty of water. Now, let's talk about laxatives. Yes, they might not be the most pleasant topic of conversation, but their role in this process is indispensable. Your doctor will provide a laxative for you to take the night before your procedure. This will help to flush out any remaining residues in your bowel, ensuring a clean and clear pathway for the colonoscope. Remember, the aim of all these steps is to provide your doctor with the best possible view of your colon. It's like cleaning your house before a guest arrives, except this time, the guest is a life-saving medical procedure. Proper preparation can make the difference between a successful and an unsuccessful procedure, so take it seriously. Now that you're well prepared, what can you expect before, during, and after the procedure? In the hours leading up to the procedure, you'll typically be asked to avoid eating or drinking to ensure your colon is clean and ready for examination. You might feel a little anxious, and that's perfectly normal. The medical team will be there to answer any last-minute questions and make sure you're as comfortable as possible. As the procedure begins, you'll likely be given a sedative to help you relax. You'll be lying on your side, with your knees drawn up towards your chest. The doctor will then gently insert a colonoscope, a thin, flexible tube with a camera and light at the end, into your rectum and slowly guide it through your colon. This part of the procedure is relatively painless, thanks to the sedative, and usually takes about half an hour to 45 minutes. During the procedure, the doctor will be looking for any abnormal growths or polyps, which could be early signs of rectal cancer. If any are found, they can often be removed right then and there, preventing the need for a second procedure. Once the procedure is over, you'll be moved into a recovery area to rest and allow the sedative to wear off. You may feel a bit groggy, and it's common to experience some bloating or gas due to the air introduced into your colon during the procedure. These symptoms should dissipate fairly quickly. In the days following the procedure, it's important to listen to your body and give it the rest it needs. You should be able to return to your normal diet and activities within a day or two. However, if you experience severe abdominal pain, heavy bleeding, or a fever, it's crucial to contact your medical team immediately. The medical team plays an integral role in ensuring your comfort and safety throughout the entire process. They'll be there to provide support, answer questions, and guide you every step of the way. Remember, every step of the procedure is designed to ensure your comfort and safety. You've made it through the procedure, but what do the results mean? Well, let's delve into the world of colonoscopy results and what they signify for your health. After the colonoscopy, the doctor will interpret the results, which can either be positive or negative. A positive result doesn't mean you have cancer. It simply means that the doctor found polyps or abnormal tissue in the colon. Now, these polyps can be benign, precancerous, or cancerous. If polyps were found during the procedure, they were likely removed and sent to a lab for testing to determine their nature. On the other hand, a negative result indicates that the doctor did not find any abnormalities or polyps in the colon. This is good news, but it doesn't mean you're off the hook. Regular screenings are vital, especially as you age, because the risk of colorectal cancer increases with age. Now let's talk about the potential need for further testing or procedures. If the lab results indicate that the polyps are precancerous or cancerous, don't panic. Remember, early detection is key in treating colorectal cancer successfully. Your doctor will discuss the next steps with you, which might include further tests, treatments, or even surgery. Follow-up appointments are crucial. They are your opportunity to discuss the results, any symptoms you might be experiencing, and to plan your future screenings or treatments. Remember, staying informed about your health status allows you to make educated decisions about your health care. Regular screenings are also important. They are the best way to catch colorectal cancer early when it's most treatable. If you're over 45, or if colorectal cancer runs in your family, you should be getting screened regularly. So, there you have it. Understanding your colonoscopy results is not as daunting as it may seem. It's all about staying informed, asking questions, and keeping up with your screenings and appointments. Remember, understanding your results is crucial in maintaining your health and taking proactive steps towards prevention and treatment.